Welcome everyone to our weekly Q&A with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Hi, good afternoon.
Good afternoon. My name is Dilshad Burman. I am a writer and reporter with City and 680 News, and I will be moderating this chat today. The way it works is we have been collecting your questions all week, and we're going to present them to the doctor today. She's never heard them before. This is right off the bat. If you haven't had a chance to submit your questions, you can still do so under this live broadcast, and we'll try to get to as many live questions as we can in this short 30-minute period that we have with the doctor. For now, we're going to get started with the ones that we've been collecting over this past week from our website and social media. So, doctor, are you ready to go?
Yeah, let's go.
All right, let's get started. So once again, this week, we're going to start with our vaccine concerns because they are top of mind for people and very, very urgent at this time. So let's start with vaccine questions. We're going to start with Frank. Frank asks, if you have had COVID before, do you still need to get the vaccine?
It is still recommended that you get vaccinated. We know, first off, well, what COVID did you have? Did you have a variant spread COVID? If you have the old COVID, you might not have protection against the variants. But we also know that despite what COVID you had, the immunity tends not to last. And so you could still get COVID again. And that's why we recommend that you get vaccinated. It will act like a booster and give you that added protection.
Right. And then Crystal asks, why is the AstraZeneca vaccine not approved for people younger than 40 years of age? It doesn't inspire confidence in the vaccine.
So the vaccine is licensed for 18 years of age and older. It is recommended, though, in 40 and up in areas where there's a lot of COVID spreading, like in Ontario, for example. The reason why it's 40 is picked is because it looks at the balance of the benefits and the risks. And so we know that this vaccine is very good. It can protect severe illness. It is a really important vaccine to help us combat COVID. We know the UK has used this vaccine and their numbers are very good. But we do know that there is this rare side effect that can occur from this vaccine. And so the age range is really balancing the benefits of getting vaccinated compared to the risks. And we know that the older you are, the more risks you have if you get COVID to end up in hospital, to end up on the ICU, and even to die. And so that's why you see that age-based recommendation.
Right. And doctor, when it comes to the side effects, we've talked about the blood clots that we've seen occurring. What is the occurrence of blood clots when it comes to the vaccine versus when it comes to just the general public or even the other COVID-19 vaccines?
Okay, so the blood clots, these severe clots that can occur with the vaccine occur in a rate of 1 in 100,000 to 1 in 250,000. So what it means is in about 1 million people who have had the vaccine, you might have 4 people or more who get this serious blood clot. Some of the blood clots, though, if they're diagnosed early, can be treated early, treated properly so that you're better. And this seems to be related to the AstraZeneca vaccine. It seems that the U.S. is reviewing some of the cases that have occurred with the Janssen vaccine. And so whether that's the same thing or different needs to be determined. It looks like it's the same thing, but does it occur at the same frequency? Like, is it still, 1 in 250,000? Right now, the U.S. is reporting about 6 or 7 cases out of 6 or 7 million doses given, which is a different rate. So that's another thing. We have not seen this side effect, though, with the messenger RNA vaccines.
Okay. And then Liz asks, I got my AstraZeneca vaccine over a month ago. Can I get my second shot now?
So the AstraZeneca is actually, the longer you wait, waiting till 12 weeks will actually give you a better response. And so really most everyone right now in Ontario, with very few exceptions, are getting that extended dose interval.
Right, and that's 4 months, right?
It's 4 months right now. Yeah, that's right.
Okay, RS asks, I hope I pronounced this correctly. I have myasthenia gravis. I have been reading that for people with MG, they should have their second dose 21 to 28 days after the first dose. Will I have to wait 4 months for the second dose of the vaccine?
You will wait 4 months right now for the second dose. The people who will get to that second dose in a short window are those who have had a lung transplant and those who are actively getting cancer treatment. Those are the only two. But if you have myasthenia gravis, while you have a serious health condition, your immune system is actually stronger than those two groups. Mm-hmm. And by delaying your second dose and everyone else's second dose, we can actually prevent more deaths. We can actually give you more protection by being able to help fight this third wave of the virus.
Right, right. And then, okay, Roger asks, every study I've read clearly demonstrates that getting the vaccine doesn't prevent you from getting or transmitting the virus, and it only reduces the symptomatic expression of the virus, meaning that it will mean less people needing to clog up the hospitals and the ICUs. So we've talked about this before, doctor, where we've talked about studies that say that they are showing now that the vaccine does sort of prevent the spread of the virus. So Roger is asking, what study are you referring to where it prevents this transmission?
So there are actually many studies that have been done based on the vaccines that the vaccines can actually prevent that asymptomatic spread, and more will be coming out. I think there's one important thing to note, though. The vaccines are not 100%. So if you actually got COVID and you were vaccinated, you could spread that COVID. It would not prevent the spread if you got COVID. But if you got COVID and you were vaccinated, you're less likely, as you said, to end up in hospital.
Right, right. And then he has a follow-up question. Do you have any numbers that you can provide on the number of positive cases in Toronto from people who have already received the first dose of the vaccine? Are we keeping track of those numbers?
So we are, that is provincially something that's being looked at. I can say that the numbers are very, very low. In some of the cases that I know about, if someone got COVID, it was like, one of them was someone in a nursing home who had just a scratchy throat and they tested it and it was COVID. It was really hard to distinguish that it even was COVID. And I think beyond what's going on in Toronto and Ontario, we can look across the world to say they've done some of this to see, you know, are you testing people who don't have symptoms, who have symptoms? Very unlikely to get someone who's very sick who's been vaccinated.
Okay. And then Greg asks, these are some Twitter questions actually. Greg asks, we won't be vaccinating toddlers and preschoolers anytime soon. And with the abandonment of cohorts in September 2020, there isn't much protecting these children. So do you believe that we could be doing more by closing daycares or creating vaccinated safe zones?
Okay, so yeah, how do we protect our children? So I think there's a couple of things. One is by vaccinating the adults around the children, or, you know, anyone who's able to be vaccinated around the children, we will protect the children. In terms of the next school year or childcare, we will still probably have measures in place like cohorts, for example, to prevent the spread, because not all children will be eligible for vaccinating. But I think it's important to note that, you know, it looks like Pfizer is going to be licensed down to 12 years of age in the US, and then usually Canada follows thereafter. So maybe half of children will be able to be vaccinated, and there will be more studies to enable younger children to get vaccinated too. You know, and so that's another hope for the future as well.
Okay. And then another Twitter question. Actually, these two are very similar. Sarah and Kyle have similar questions. What procedures are put in place at vaccination clinics when people do not show up for their appointments and cancel at the last minute? Are there standby lists? Are there, you know, any procedures for no-shows, basically?
So each clinic will have their own procedure for how to handle that. Some clinics may overschedule people, recognizing that they have a regular, say, 10% no-show rate. The vaccines, I know people are concerned that if someone doesn't show up, that vaccine gets thrown away, and that's not the case. So the vaccines do not get thrown away. Some clinics do have some ability to handle, you know, last minute or changes in the schedule as well too. So each clinic will have their own way of determining how they handle no-shows, but the vaccines don't get wasted.
Right, absolutely. In fact, yesterday we saw that Humber River Hospital put out a call for people to come down because they had AstraZeneca vaccines to give people, and I guess they didn't have, everybody didn't keep their appointments. So towards the end of the day, they sent out a tweet saying that, come on down, if you're eligible, you can get the AstraZeneca vaccine.
Yeah, and I think it's important to know, like, we don't want people to come to clinic if they're sick. And that's one of the questions that's asked. If you have any symptoms, please cancel your appointment. And so, some of the no-shows are actually good because people have actually stayed home and rescheduled their appointments as well, too. And so I think that's another important point, that it may actually show that the clinics continue to be safe as well to not spread COVID.
Yes, absolutely. Okay, let's go back to some other submitted questions. Joel asks, firstly, do the vaccines protect people from the new variants of COVID-19?
So the vaccines, yes, will provide protection against the variants. How well they provide protection, I mean, we don't have the exact data on that, but you can see the UK variant, which is spreading in the UK. It's their predominant strain. The vaccines that they've used there, Pfizer and AstraZeneca, have worked well. New variants will come along, and, so we'll just have to assess it time by time. This is another reason why getting vaccinated is important, but until we get the rates really low with new variants coming, we're really going to have to continue with those public health measures as well, too. The wearing your mask, keeping your distance, staying home when you're sick.
Right, absolutely. And then sort of an expanded question on the variants here. This person puts their name in as trying to be optimistic. They ask, I've heard that our currently approved vaccines do not protect against the South African variant, which is still spreading here in Ontario. Is there a risk that by the time we have been vaccinated against the wild type of COVID-19, and that vaccine seems to be effective against the UK variant, the South African variant will be out of control and will require strict lockdowns and stay-at-home orders once again?
Yeah, so good question. I think trying to be optimistic, be optimistic. We do know that Janssen has some data that shows that they have protection against the South African variant. So I have seen that. I haven't seen any data specifically for Pfizer and Moderna, and so we'll have to wait to see whether they provide good protection. But I think in the meanwhile, while we're in this wave 3, I mean, the predominant variant is that UK variant. And if we follow the stay-at-home orders, we can get all of the cases down, the new variant, the old variant, and anything else. And that's going to help prevent something like a new variant from spreading right now.
Right. And we have some live questions coming in here, though. So let's start with Marlon. Marlon asks, when will the province lower the eligibility age from 60 plus to 55 plus for Moderna or Pfizer vaccines at the mass clinics regardless of postal code?
Okay, so based on the prioritization, we're in phase 2 prioritization, and it is to go down by age. And right now, the rate limiting step is the amount of vaccine that we have. But you've heard the announcements from the federal government. We are getting a lot more of Pfizer vaccines, and the shipments are supposed to start in May. And so once we have more vaccine, there will be more people who can be added to the eligibility list.
Right. And then Arden asks, can you please address why pregnant women aren't being prioritized for vaccines?
So the Society of Obstetricians and Gynecologists recently put out a statement stating that in pregnancy, we're finding more pregnant people are ending up in the ICU. Maybe it's related to this UK variant. In pregnancy actually is one of the risk factors for vaccination. It's an at-risk condition. So those groups haven't come up yet to be eligible. But this is something that is under active discussion to see if we should vaccinate in pregnancy sooner. So please do, if you're pregnant and looking for the vaccine, don't meet any of the other eligibility criteria. Keep an eye out in case things change.
Right. And then Crystal asks, so are there current studies being done on children, I'm guessing when it comes to vaccines, because we know that the virus surges when schools open?
Yes, there are. So Pfizer has completed their study in 12 to 15-year-olds. Moderna has a teen study that's ongoing as well. The studies for AstraZeneca have been halted, but some of the other vaccines also have studies in line for children as well.
Okay. And then Christopher asks, when are you getting vaccines for people who are educators working in a daycare center in Ontario?
So right now, essential workers who cannot work from home are scheduled to be vaccinated mid-May, to start being eligible in mid-May. So that's right now what the schedule is.
Okay. And then Kimberly asked, I'm assuming this is with reference to the AstraZeneca vaccine. What about people who already have blood clots?
So the AstraZeneca vaccine, that rare clotting disorder that can occur, is actually very different from the usual clots that people can get, either a DVT, a deep vein thrombosis, or a pulmonary embolism, even related to some medications. That's a very different mechanism. And so Thrombosis Canada has come out to say that if you've ever had a blood clot, if you're on medications, if you have a family history, the AstraZeneca vaccine does not put you at higher risk for that vaccine-induced clots. It's a very, very different process.
And is that the same for people who are currently dealing with blood clots, like right now?
That's right. So exactly. So if you're currently dealing with a blood clot, it's not considered a contraindication to get the AstraZeneca vaccine. That being said, it's up to each individual to make their own informed choice based on what is important to them to decide.
Right, absolutely. And then Aurora asks, are there any other vaccines that'll work against the variants?
I think it depends on the variant. I mean, right now we have 3 predominant strains. We've heard that India has maybe some new strains. So, but yes, even if a vaccine doesn't provide the best protection against a variant, we know that vaccines can provide cross protection. And so if it can at least give you some protection, it might keep you out of the hospital, for example. And so that's another thing to watch for. Even if a vaccine does not provide the best protection, it can often still provide some protection.
Right, and this might be a repetition, but Daniel just asked, because you just mentioned the double mutant variant in India. So do we know if the current vaccines provide any protection against the double mutant variant?
Yeah, I'm not aware of any evidence for those variants. Again, there's a different kinds of studies that are done to see if the vaccine works against the variants. Some of it is in the laboratory, to really check the vaccine based on the virus that's there. And some of it is the real world data. I know some people don't always understand what that means. But that is like looking at the UK, looking at Israel. They have the UK variant and they vaccinated and they've been able to get their numbers down.
Right. And then another live question here from Sean. We've talked about this before, but good to reiterate. Can you get a different vaccine for your second shot from your first shot?
So we're waiting for some more studies to be published. The UK has done a study on this. We call it a mixed model, one AstraZeneca, one Pfizer, for example. And so right now we can't really say to you, yes, it's good, no, it's not good, and so until we get some of that data, the recommendation is as much as possible to complete your series with the first vaccine that you received.
Okay. And then let's see. We've got one more live question coming in here from Marlena. Are you somewhat protected after the first dose of the vaccine? And if so, for how long are you protected with that first dose?
So you're actually more than somewhat protected, actually. So, the CDC did a study that showed that you actually have 80% protection after 1 dose, and after 2 doses, 90% protection. So you have very good protection. We know that protection is strong, and we know that it lasts. We know that it lasts for 2 months longer now. And we also know, looking at the UK, they extended that first dose as well too, and found that the protection for the first dose lasted until most people got their second dose, based on the rates that have been circulating there.
Right. And then Hadley has an interesting question here. What is the criteria when a divorced parent with a child is eligible for a vaccine because they live in a hot zone, but the other parent is outside the hot zone, but is equally exposed due to the child constantly transitioning between the two parents?
So right now it's based on your residence, where you live. In some circumstances, it's also based on where you work, like for education workers. And so that's the criteria that's being used right now.
Right, okay. So when it comes to that kind of a situation, then doctor, what would you recommend? One parent is vaccinated, the other parent is not, the child is going between the two parents. What would you recommend in terms of safety or, making sure that nobody catches COVID?
Yeah, I mean, I think there are many households that have some people vaccinated and some people not vaccinated because some people have been eligible and some others haven't. And so I think, as with we've done throughout the pandemic, there are many people in this situation, and we just have to reduce our risk of spreading COVID, at all times.
Right. Okay, let's go back to the submitted questions here. One from Noodle. Noodle asks, most of the new variant infections are in younger people who cannot work from home, also known as essential workers. Why are they not getting prioritized along with teachers for vaccination?
So essential workers who cannot work from home will become eligible in mid-May. And so that's in just a few weeks. And so I think there will be a lot more to come on the sequencing and where to get your vaccines very shortly.
Okay. And then just a follow-up question, doctor, from the question that was just asked regarding how long protection lasts after the first dose. Dan asks, if the protection lasts for 2 months, then why are we waiting for 4 months for the second dose?
Oh, no, the protection lasts for more than 2 months. Thanks for clarifying that, Dan. It lasts for more than 4 months, for 2 months. We know for sure at 2 months you have still very strong protection. And we know that by month 3, month 4, your protection is not all of a sudden going to drop. If it wanes, it will wane slowly. And so you're not going to go from 80% down to 0% by month 4.
Okay. And then Triel asks, do the antibodies from the vaccine stay in your body for life?
We don't know how long they will stay in your body for. Sometimes antibodies, how do we even know that you even have antibodies? It's through a blood test. But is the blood test even that great at determining whether you have antibodies? I mean, sometimes it's based on what kind of test do we have to see if you have antibodies. The real question becomes, how long will you be able to prevent people from getting sick? And so, if down the line you need a booster dose, then we will recommend a booster dose.
Right. Okay, let's go back to submitted questions again. Sheen asks, I think you just addressed this, but we're just going to ask Sheen's question here. Why don't people who work in hotspots in York region, for example, qualify for a vaccine? A person who lives there and does not work outside the home is eligible, but a person who goes to work daily in that postal code is not eligible.
So it depends on the kind of work. So right now, education workers, if they work in a hotspot in Toronto, are eligible, and that's really the only place where, and healthcare workers as well too. But as we go into mid-May and essential workers become eligible, you'll be eligible to receive the vaccination. So that's just, you have to understand that some of these determinations are based on limited vaccine supply. And, in the coming weeks, the vaccine supply is going to increase and will continue to increase into June, which is going to help a lot more people to be able to get vaccinated.
Right. And doctor, recently we heard there were a few hotspot postal zones that had been allowed to register for vaccines, even if you were 18 and over. Some people with the same sort of lifestyle and criteria got emails saying that they should book their vaccine. Some people did not and are still waiting. Is there a difference? Is it like a random lottery system? Why is there a difference when, say, people of the same age group living in the same postal code, but some are getting emails and some are not?
So you would have to follow up with the clinic that you registered with to find out what their criteria is. It does vary slightly, even within our city. The number of vaccine that's at each clinic varies, and the risks also vary. And so what I would suggest is you would follow up with the clinic to find out what their criteria is. Again, a lot of it may be based on vaccine supply, and we've seen clinics have to make very difficult decisions because they don't have enough vaccine. And so hopefully that will be better in the coming weeks.
Right. Okay, back to some submitted questions here. Young Elder asks, some who are infected with COVID are symptom-free. So can I get a vaccine if I'm symptom-free but infected with COVID? And you wouldn't know that you have COVID.
Yeah, so even if you have an active COVID infection and you don't know it, the vaccine is still safe for you. It will still work for you, so you're still recommended to get vaccinated. The vaccine won't help you fight a current infection that you have. If you know that you have COVID, or if you've been in close contact with someone and are supposed to be self-isolating, you shouldn't get vaccinated because you actually are in self-isolation, and we don't want you to come to the clinic where you could expose others.
Right, right. And then Belle asks, I had my first dose of the Pfizer vaccine yesterday and I had a screaming headache, extremely tired, and I had nausea. I'm starting to feel better, but is this normal after the first dose?
So yes, I mean, 10% of people can get these symptoms. And the allergists tell me that it means that your body's fighting an immune response, that it's building an immune response. If you get side effects, like that's kind of a positive way to think about it. The side effects usually last for 3 days. If they last longer than 3 days, or if they're very severe, please do seek medical attention.
Right. And then Maria Martinez asked, again, we've addressed this, but when are kids likely to get the vaccine?
Right. So, I mean, we're waiting for the vaccine to be licensed. We're looking at recommendations provincially to be able to provide for children. Right now, kids are less risk than adults. I mean, kids are getting COVID. Their rates are very high, but they're not getting as sick from COVID. And so if you look at the prioritization is still for adults by age, because they are still the ones that are getting very sick from COVID.
Right, right. Okay, so that's the end of our vaccine questions for now. If you have vaccine questions, you can still submit them under this live broadcast. I'm just going to continue onwards with the submitted questions that are not entirely vaccine related. So Shailendra, who is one of our regular contributors, has 2 questions. His first question is, does the WHO recommend workers wearing masks at workplaces? And if yes, what type of masks?
So yes, masks are certainly recommended for anyone who works indoors, even outdoors, especially if you work with other people, cannot keep a physical distance. And so which mask you should wear, you should actually follow up with your employer, because it will depend on specific scenarios. Like when I work in the emergency department, if I'm in the middle of a resuscitation, I will wear a different PPE compared to seeing patients otherwise. So the PPE that you're required is supposed to be available to you for your job, and so I would follow up with your employer on that.
Right, and then his second question is about flying in airplanes. How can ventilation reduce the risk of contracting COVID-19 in airplanes? Since a plane's cabin keeps the air circulating, will I get sick if another passenger is sick?
So, I mean, I think some of it depends on, is it a variant or not a variant? Like with the regular COVID, we didn't actually see a lot of spread on airplanes. I think there are a number of measures in place to try and keep people who have COVID and are contagious off the plane, like the testing beforehand and wearing masks, for example. Ventilation in airplanes can actually be quite good. I'm told that they can actually get a lot of air exchanges that can help with the ventilation. But again, as you said, it's a closed environment. You may not be able to keep a physical distance from others. And so those other precautions are definitely going to be important as well.
Right, right. I mean, the idea is to just not get sick people on the plane altogether.
Yeah, and even, some people may not know it, or they may not have tested positive. And, as much as you can, keep a physical distance, wear your mask, wash your hands, like all of those things as well. Yeah. Right,
absolutely. Okay, and then Patrice asks, I'd like to know why I can go to Walmart or Costco with 25% capacity, but I can't have my immediate family watch my son get married in church with only 10 people. How is this fair?
Yeah, so I mean, I think there are a lot of really difficult sacrifices being made in COVID, and I absolutely hear your frustration and your sadness, and I extend that out to you. I think we have seen in those indoor settings that COVID has spread, and often when you're at a wedding, it's your family, you will hug or get close, and there's no question that COVID has spread at weddings, which is extremely unfortunate. The bride or the groom getting COVID, the guests getting COVID, getting very sick from COVID. It's not the kind of wedding that you want to remember or want to, you know, if you can prevent that, you want to. So I think that's the bigger picture to remember here. We're in the midst of the third wave, the largest wave with the most contagious virus that we've seen so far. And that's why there's strict measures in place. Now, comparing that to the grocery store, at the grocery store, you know, there are supposed to be very strict measures in place so that COVID will not spread there. They are only selling the essentials so that you go just for essential reasons as well, too. And, you know, these are part of the balances and the trade-offs to be able to help us fight this wave right now.
Right, absolutely. And then, okay, let's talk about ivermectin. We've heard this medication mentioned a lot over this past pandemic. So D. Martin asked, I've been wondering why our health professionals have decidedly refused to pursue the known successes and benefits of treating COVID-19 patients with ivermectin. There have been numerous studies that show they have impressive success, and it has a much longer safety track record than the vaccines that are being used right now. So are we or why aren't we using ivermectin?
So when it comes to treating COVID, there are a number of medications and treatments that are being used based on, you know, how sick the patient is. Are they in the ICU? Are they able to go home, for example? And so your treating physician will decide what is the best medication for you at that time and prescribe that for you. The treatments, the medications that are used, though, are treatments for someone who has COVID. And often it's given to the very sick patients, patients who are admitted or are in the ICU, whereas the vaccine is trying to prevent COVID. And I think, you know, if you can prevent getting COVID, that's a very different scenario from actually treating someone who has a severe illness.
Right, absolutely. It's not the same thing. If you can prevent it, that's the vaccine. If you have to treat it, then it's a whole other medication. Absolutely. And so we have 1 minute left, and I'm just going to squeeze this question in. Millie is asking, like you said, regarding treatment for COVID, why is convalescent plasma treatment not being used here? I understand that the US is using it quite successfully to treat COVID patients if given early enough.
So the treatments that are used to treat COVID patients are based on medications that are approved by Health Canada. It's the same type of approval process that is used to approve vaccines. And so unless you're in an experimental trial, for example, the medications or the treatments that are being offered are based on the best science and the licensure from Health Canada.
Right. Okay. And that brings us to 1 o'clock. Thank you so much, doctor, for taking the time and having the patience to answer all of these questions for us. Thank you to everybody that submitted live and participated in today's session. The doctor will be back with us next week, so you can ask her more questions then. Thanks so much, doctor.
Okay. Bye-bye.
Bye-bye.